Welcome to the Washington Wellness Diabetes Prevention and Management Programs module presented by the Washington Wellness Team at the Washington State Healthcare Authority. By the end of this module, you will have a greater understanding of the difference between pre-diabetes, type 1 and type 2 diabetes, the burden of diabetes in Washington State, the health disparities surrounding diabetes, as well as the diabetes prevention and management program benefits offered to employees, and how you can include diabetes prevention and management in your wellness programming. The next two slides provide a high-level overview of prediabetes, type 1, and type 2 diabetes. When you eat, your body breaks food down into sugar and sends it into the bloodstream. This sugar is called glucose and is the main source of energy for the cells in our organs. When the body doesn't need to use the glucose for energy, it stores it in the liver and muscles for later use. The pancreas, one of the largest glands in the body, produces and secretes insulin. Insulin is a hormone that acts like a key to let blood sugar into the cells for use as energy and helps maintain normal levels of glucose in the blood. Very generally speaking, diabetes is when your body either cannot produce or cannot use insulin, and as a result, your blood glucose level is too high. The illustrations on this slide show how glucose is used by the cells. The image on the left represents normal glucose metabolism. As you can see, the glucose in the bloodstream is being used by the cells for energy. For those who have pre-diabetes, the level of glucose in their blood is too high, but not high enough to be called diabetes. In the illustration on the right, you can see that there is more glucose in the bloodstream, and the cell is unable to use it. When you have too much glucose in your bloodstream, this can affect how your heart and blood vessels work. So as your pancreas makes more insulin to try to get cells to respond, the pancreas can't keep up, and your blood sugar stays elevated, leading to type 2 diabetes. Type 2 diabetes is the most common form of diabetes. It is also more preventable and modifiable than type 1, which is a true autoimmune disorder. There are three main types of diabetes: type 1, type 2, and gestational. For the purpose of this presentation, we will focus on type 1 and type 2. The inability to control blood sugar causes similar symptoms and complications with both type 1 and 2, but there are a few key distinct differences between the two. Type 1 diabetes, previously known as insulin-dependent diabetes, is an autoimmune condition that usually starts during childhood, but can also occur in adults. The body's immune system does not recognize the cells in the pancreas that make insulin and attacks and destroys these cells. The illustration on this slide for type 1 diabetes shows an image of your bloodstream. With type 1 diabetes, your pancreas either doesn't make insulin at all or it makes very little. Without insulin to bind to the insulin receptors, the glucose can't enter the cells. When glucose can't enter the cells, it builds up in the blood, causing hyperglycemia. The result is that the cells can't get the energy they need. Having high blood sugar can cause other health-related problems as well, such as nerve damage, heart disease, and stroke. There is no cure for type 1 diabetes, but the condition can be managed. Type 2 diabetes is the most common form of diabetes, also known as insulin-resistant diabetes. The image on the right of this slide, labeled type 2 diabetes, illustrates a bloodstream in which the body does not develop enough insulin, or the insulin does not work properly. In the diagram, you can see that insulin has binded to the receptor, but it's not allowing the glucose to pass through the bloodstream and into the cell. Over time, the pancreas gradually loses its capacity to produce insulin. Type 2 diabetes is caused by several factors, including obesity, sedentary lifestyle, and genetics. In 2019, there were approximately 6,300 deaths in Washington state from diabetes, making it the 7th leading cause of death in Washington. Among those who were hospitalized, nearly 117,000 had diabetes listed as either a primary or secondary reason for patient admissions or observation stays. In Washington state, over 700,000 adults and about 4,700 youth have either type 1 or type 2 diabetes. This comes out to about 1 in 8 adults and 1 in 400 youth. Approximately 2 million people total are living with prediabetes. Currently, the estimated cost of diagnosed diabetes in the state is roughly $6.7 billion in 2017. This was comprised of $5 billion in direct healthcare cost and $1.7 billion in reduced work productivity. The estimated average lifelong cost of diabetes for an individual ranges from $55,000 to $130,000. Some groups or communities carry a disproportionately high burden of diabetes-related poor health outcomes. Here are a few examples. In gender, males are more likely than females to have diabetes and experience increased diabetes-related hospitalizations and deaths. For age, adults 65 years and older are more likely than their younger counterparts to have diabetes and coexisting conditions, as well as experience increased diabetes-related hospitalizations and death. In race, communities of color, including non-Hispanic Blacks, Native Hawaiian and Pacific Islanders, American Indian and Alaska Natives, and Hispanics are more likely than non-Hispanic whites to have diabetes and again experience more diabetes-related hospitalizations and deaths. When we look at socioeconomic status, adults with lower incomes and levels of education are more likely than adults with higher incomes and education to have diabetes. Adults with lower incomes are also less likely to be aware of having prediabetes. Given the burden and the ongoing health and economic costs of diabetes, Washington Wellness continues to make diabetes prevention a priority. Each year, our team works with PEBB and SEBB organizations to increase awareness of diabetes and its impact. We provide education, toolkits, and resources to wellness coordinators to support their promotional efforts, and we promote the diabetes prevention benefits available to employees and their eligible family members. And finally, we continue to participate in a leadership role on the statewide cardiovascular and diabetes network leadership team. This network of private, public, tribal, educational, and governmental organizations identifies priorities and develops strategies around the prevention of cardiovascular disease and diabetes to align with the goals and missions of the participating organizations. Now let's take a look at the diabetes prevention and management wellness benefits available to covered members and their family members. For those enrolled in Premera plans, the diabetes prevention and management programs are offered through Teladoc Health. To get started in these programs, visit their website or call the Teladoc member support line. This slide provides a summary of the Teladoc Health Diabetes Prevention and Management benefits for Premera members. Their model includes personalized, actionable, and timely support, remote monitoring and emergency outreach, live coaching, smart devices, and dedicated coaching services. Now let's take a look at the diabetes prevention and management wellness benefits available to eligible employees and their family members enrolled in uniform medical plans. UMP's diabetes control program contains elements that reduce the risk of common health complications associated with diabetes. This program also works to help participants manage blood sugar, cholesterol levels, blood pressure, and weight. Their support structure consists of checking in quarterly with a nurse to go over general wellness, weight and diet management, review any labs, and address foot care that may be needed. In addition, pharmacy services and medication reconciliation are available. The program also includes educational material such as biannual newsletters, tips on foot care, and nutritional recipes. To get started in the diabetes programs through UMP, visit the appropriate web address listed on the screen. Additional information about this plan's coverage can also be found in your certificate of coverage. This slide provides a summary of the diabetes prevention benefits for UMP and Kaiser members. This program is offered through UMP and Kaiser's partner, Omada Health. Omada combines the latest technology with ongoing support to help you build healthy habits that last. You'll be paired with a professional health coach, a wireless smart scale, and a supportive peer group. Your UMP or Kaiser plan covers the cost of this program at 100% for qualified subscribers. To get started with Omada, fill out a brief application at the appropriate links below on this screen. Omada has so much to offer. Learn more by visiting their site. Omada Health's program structure includes targeted outreach and enrollment based on population demographics, smart tools and technology such as an interactive app and wireless smart scale, online peer groups to share ideas, encourage, and support each other, interactive lessons designed to help you achieve your goals, professional health coaches to talk with and develop customized plans, and a whole person care approach that contains in-person referrals and an evolving care team. Now let's take a look at the diabetes prevention and management benefits available to employees and enrolled family members in Kaiser plans. Kaiser offers diabetes control for both Kaiser Northwest and Kaiser Washington members. Kaiser's focus on prevention and integrated care has reduced the rate of diabetes among members, and their care team approach helps members who do have diabetes lead healthier, happier lives. To get started or learn more, visit the appropriate link listed on the screen below. This slide represents the care model Kaiser Northwest and Kaiser Washington use for diabetes. The purpose of their program is to support primary care, education, consultation, and program coordination and development. They focus both on having the right people and using a comprehensive care process. The diabetes team consists of diabetologists, clinical nurses, insulin nurses, and pharmacists. Kaiser's approach to diabetes management includes chronic disease management with a special focus on outreach and clinical specialists, and consultations both face-to-face and virtual. So how can you include diabetes prevention and management in your wellness plan? People with diabetes live with the disease all day, every day, including at work. Although people with diabetes may face unique challenges at the work site, they can overcome these challenges and be successful with the help of an informed employer. You can maximize the health and productivity of your workers with diabetes by being more aware of common concerns in the workplace, such as accommodations for people with diabetes and shift work. Address the importance of healthy food choices in the workplace by introducing a diabetes initiative nutrition program that includes healthy food options at the workplace, cooking classes, and workshops on how to read food labels. This helps to support employees with prediabetes and diabetes make healthier food choices. In addition, introduce a specialty tailored wellness program, which encourages diabetic employees to exercise regularly, such as walking or gym sessions. Using Smart Health, share some resources such as Learn More About Diabetes Prevention, National Diabetes Month, and American Heart Month. Learn more about, promote, and encourage employees to participate in the diabetes prevention and management benefits available to eligible employees and their family members, the Omada and Teladoc Health prevention programs. You can use our toolkits to help promote these programs. You can also use the CDC scorecard, which is a tool designed to help coordinators assess the extent to which they have implemented evidence-based health promotion interventions in your work sites. The scorecard assists coordinators in identifying gaps in their health promotion programs, and helps you to prioritize high impact strategies at your worksite, including organizational support, tobacco use, nutrition, physical activity, weight management, stress management, and more. It's a great way to help establish a healthier workforce. To help promote the diabetes prevention and management programs, we have compiled resources ready for you to use. You can find these resources for PEBB and SEBB employees on the Healthcare Authority's website. You can also find toolkits for promoting diabetes prevention on the Washington Wellness webpage. All links are listed out on this slide. Thank you for taking the time to learn more about diabetes prevention and management resources available to members. We are here to help provide you with the resources you need to develop and build your wellness program. Feel free to reach out with any questions. Be well.